audio, and then stop video down on the left, bottom left.
Okay. And then so we're just waiting for this to come up. And then will like volume come on there?
I think so. Is your computer unmuted?
Yeah.
See, we're back.
We're back. Viewing party.
Just turn on the tournament instead.
You might want to mute your computer.
What's that?
You might want to mute your computer.
Oh, do you hear all that? How do I
click mute?
that you have to, as a PI, be giving them everything they're looking for in a funded project, and also be fitting in the things that you're trying to do in your research agenda. But it really has to be focused on what they want. Oops. Now my thingy doesn't work. Oh. Now it will. Okay, it didn't. Zipping ahead. So we suggest that as PIs are learning about an agency, that they be able to ask these questions, that they know the mission and history. We know that out at Anschutz, people tend to get tunnel vision around the NIH, but we encourage faculty to diversify their funding portfolio and to become aware of other agencies that may be a good fit for them in their research. So as they're getting to know those agencies, and they've been very used to working with the NIH, to understand some of the background like these questions get at about the agencies. We then encourage them to work with program officers. Oftentimes in the grant development process, the relational side is left out. We just think of it as writing a grant proposal and submitting the grant proposal and seeing if you get funded. But we encourage folks to reach out to program officers to make sure that before you put in all the work to develop a full proposal, that you know it's a good fit. So you have that concept paper or a specific aims page that you are sending to a program officer.
Oh yeah, I finally responded. Yeah, I was thinking the same thing.
Can you give me any feedback? And they will give you feedback in terms of, maybe a little more preliminary data. I have things here. This is
like super late.
Really, we can and you know which way to go in terms of develop your grant.
I was one. So I was almost tempted to just assume.
So this is just kind of briefly the process. And I think this link can be sent out if you want to look at any of these resources later and spend more time with it. This is
Well, I mean,
how you reach out to program officers. Always want to have your PIs drafting that one pager or the specific aim
following up. So
where
this
they
is
reach out to a program
decided
officer.
afterwards. I was like,
If they haven't,
and it worked. I just got it this morning actually at 10:05.
Oh, good.
Oh,
then they're going to spend the next 24 hours
So
trying
it
to
worked.
get some semblance of a decent specific
bring out the
together to send to them. So
Oh,
I always recommend have it ready so that you are confident once you see the interest of a program officer, send them that one pager to keep that
You saw I sent
conversation
you,
going.
I finished my progress report.
Yeah, I'm gonna log in and I'm gonna see if it's just a warning. It's okay.
When you're writing a grant, and this is very general advice, George Heilmeyer, who is the former director of DARPA,
Yeah, I'll check. I'll go check it out.
some of you may be familiar with Heilmeyer's catechism in the grant development world. He suggested, after many years running, he suggested that every good grant be able to answer these questions. So it's always a good resource. It helps PIs to zoom out a little bit. Sometimes they get so focused on their research, it's hard for them to think more broadly about what they need to be doing to really sell their research and their project and themselves in a grant proposal. And then lastly, while we have a few minutes left, I was going to go through some of these quick grant writing tips that I feel can make a big improvement on proposals. And these are also things that I often see our PIs missing when I review their proposals. So firstly, and I'm sure I don't need to tell this audience this, but PIs really need to be reading those program guidelines again and again and again and again. Something like 60% of proposals that are received by agencies are rejected without being reviewed. Because one, they weren't a good fit for the agency, or two, they didn't follow the guidelines, they didn't follow the rules. So we have to make sure that our PIs are clear on the rules, not just that we are clear on the rules, but they also are clear on the rules and the fit that their research has with the guidelines and the program call, the program announcement. to make sure that they aren't doing all that work for nothing when it's thrown out if they miss any of those pieces. This rule of primacy and recency is especially important in specific aims pages or conceptual documents about PI's research. This idea is that people remember what they read first and last the most. So when we think of the specific aims or the project summary as real estate, the things you're putting at the very top of it and the very end of that page are prime real estate. That's the most valuable real estate you have in your specific aims. So you really need to be grabbing your reviewers with how big the problem is, how important this work is, right at the get-go. And then instead of, and I see this more frequently, instead of ending your specific aims or project summary with logistics or other details about the project, come back to the vision, get people excited, get your reviewers excited about it so that they're ready to go read the rest of the proposal. They're excited about what you're doing. They're already bought in. Most reviewers report that they know upon reading the specific aims or the project summary, they know whether a proposal will be successful or not, or will be funded or not, just on that one page. And like I say to faculty, you don't want to be trying to fight an uphill battle once they're disappointed with your aims. You're going to try to convince them in the rest of the proposal. It's probably not going to happen. Define your terms. Our faculty, as you know, like to use lots of jargon. I encourage them to think really hard about whether they need to use all that jargon. Sometimes they do. If they do, they need to define it and they need to use it consistently. Because I've seen plenty of proposals where they will define jargon up front, but then you get halfway through the proposal and they're using the same term in a different way, but they had defined it like this and now they're using it in a different way, which happens in a lot of these fields when you're just having conversations about your research. But you forget that reviewers who just move a little bit out of your exact discipline may be on that panel, and now you've thrown them for a loop because you've changed the meaning of this jargon you defined. Don't let questions build up. I also recommend to PIs that they have folks review their proposal and to write down where they have questions. It's okay for a question to come up in a reviewer's mind when they're reading specific aims or a proposal, but you need to be sure you answer it pretty quick for two reasons. One, you don't want to plant doubt in your reviewer's mind that you don't know the answer to that question or you haven't thought of that question. And two, if you start having questions build up in everybody's mind, and we've all experienced this, you can have one question that hangs out there for a little bit, but if you get another question in the next paragraph, and the next question in the next paragraph, pretty soon you're so distracted by all the things you're wondering about and questioning in a proposal that you're not paying attention to what else is being written. Use active language, use first-person active language as much as you can, unless the guidelines specifically call for third person, which I have seen some that have. So to remind us all of these grammar school rules, third person passive is the research will be conducted by the research team. First person active is we will conduct the research. So you can see two reasons. It's easier for people to read active first person. So when reviewers are trying to go through all of these proposals, it's easier for them to follow. Secondly, you cut down on a lot of words when you switch from third person passive to first person active. And again, when we think about specific aims as real estate, you don't have a lot of room for extra words that you really don't need and actually make it harder for reviewers to read it. Use buzzwords, not jargon. So this idea is whenever you can cut out jargon, which is the technical terminology in your field, that's a good thing. If you can explain it without using the jargon, it'll be more easily understood. However, you should go and use the buzzwords that the agency is using. If they're saying something is so important, collaborative work is so important, and these are their pillars for what they're funding this year, absolutely use that language. Spell it out for them how you are responding to what they've said is important to them. So use their buzzwords, absolutely. Don't use your jargon. Don't sacrifice white space. When I review proposals, and I'm sure you have all experienced this, sometimes somebody sends something to you and you click it open and it is a solid wall of text. It is left justified and right justified. There are no images or figures. There are no breaks between paragraphs. And I always say, like, a part of me dies when I see that. And then I take a deep breath and I start to review it. But as much as we can encourage PIs to keep that white space in, it's valuable for a reader. If you think about the reviewer experience, you don't want a part of them to die inside when they open it, because again, if you frustrate them or annoy them or give them a bad feeling about your proposal immediately, it'll be hard to come back from that. I always recommend using visuals, even in the specific aims page or a project summary, if it's allowable. If you can create a conceptual diagram that very quickly helps the reviewer understand what this whole thing is about, that is a win. They are going to use that to remember it. If we think about what happens on study sections at the NIH, most of the people who are scoring the proposals haven't read it. They're just seeing the specific aims pop up while they're trying to listen to the primary and secondary people talk about what they liked and what they didn't like. So that's the only chance they get with your project before they decide what a score is. So having that conceptual diagram to help them understand what it is very quickly is super helpful. And then lastly, I encourage faculty to use headings in their grant proposals. If the guidelines give you headings, absolutely use those headings. If they don't, think of consistent headings that can help your reviewers to navigate the proposal. I think oftentimes we start to think that reviewers will sit down and read a proposal from page 1, page 2, page 3 consecutively all the way till the end. But we know that's not what they actually do. They'll usually read the specific aims first, but then some will flip to the budget and some will flip to the bio sketch. Who is this person that's going to do this research? Rarely are they reading it from front to back. So allowing them to have those signposts and those headings where they can easily navigate it will help them. So I am at time. Thank you so much for inviting me again. And I think we can send this presentation out if you wanted it. Feel free to contact me with any questions. And if you want to refer your faculty, the best way is to send them to our website or have them email myself directly, and we'll get them set up with whatever they need. So thank you.
Okay, thank you very much, Naomi. And I apologize, I guess I just assumed everybody knows me, but just in case you don't, I'm Teresa Cochran. And our next presenter here will be Steve Van Uren. He's going to tell us about what's going on here at the campus and the expansion plans. Would you like the mobile or the? Okay. All right, so let's shut that off. And let's escape out of this. New share. And which one is yours? This one.
Steve's presentation, yeah.
Okay, let's see. How do we make it full screen? Here we go. Oop. Yeah, there you go.
Thank you very much, and thanks for inviting me. I found that pretty interesting on the research tips. I've never written a research grant in my life, but I've written many business plans, and I've probably read almost 1,000 business plans. And those tips are actually very helpful when you're asking investors to write a check for your company. Those models actually work very well. I wish I would have known that many years ago when I struggled to try and get investors to write me a check for my companies. My name is Steve Van Uren. I work in the Chancellor's office, and so Don Elliman is my boss. I wear 2 hats here at the university, thus the logo of both on the screen. The first one is I'm the Associate Vice Chancellor for Biotechnology at the university. What that means is dealing all with industry. whether that is a big collaboration that we're working on right now with Children's Hospital on how you conduct research, on to starting companies, which we'll talk a little bit about, or trying to increase the amount of industry funding we get so we can diversify our revenue streams in research beyond just the NIH. So a lot of people ask me, well, what's the biotech scene look like in Colorado? You hear about Boston and San Francisco all the time, and is Colorado just a flyover state? Actually, we're doing pretty well, and we continue to grow each year as we move forward.
I'm just going to move the mouse because it's
great. Thank you. So you can see from an economic impact, there are 30,000 direct jobs, over 700 biotech companies now in Colorado. And it's grown about 20% over the last few years, and it continues to grow. And Colorado is also 5th in the nation for startup activity. So even though we're a flyover state, we're now starting to see people stopping and coming to the Anschutz Medical Campus. And we'll talk a little bit about that further. How many people know why it's called Fitzsimmons? Yes. Very good. William T. Fitzsimmons. And so there's the Fitzsimmons building still today that we used to call Building 500. That campus, the Army came here in 1918. It was a former nursery site. So they grew plants and trees and things here. And the Army took that over in 1918. And they focused on treating lung diseases when they were using mustard gases in World War I. And today it's still one of the best places in the world for pulmonary and treating lung disease. The base was closed in 1995. It's called Brac, Base Realignment and Closure Act. There were 2 of them actually here in Colorado, Lowry, which is now a housing complex, and this campus. And they closed it in 1995. They officially closed it with taps played, cannons fired in 1999. I have 2 staff that were at that ceremony that day. So at that time, there were 4,000 jobs lost. So 4,000 people came to work here every day, and 4,000 jobs were lost. 283 buildings were over than 30 years old. Knocked almost 400 buildings down in this. They had landfills, asbestos. So the Army did not leave this in a very good position for us. But look at it today. There is nothing we can't do in medicine on this campus. I deal with industry all the time, like I mentioned, and I test them. I say, you tell me what you want to do, and I bet we can do it on this campus, and we can. So a physician can see patients in the morning at the hospital. They can teach at the medical school at noon, walk over to their lab at 1, see their company at 2, and they never even move their car. That's a very unique situation. I've traveled all over the world looking at biotech parks. That's a very unusual situation. Usually one of those components you have to go somewhere else to do, not on this campus. So we like to call it from Brac to brilliant. And so they had a long-term master plan, of which now there's been over 4.1 billion, and there's another $300 million building going up here on campus. So they developed a long-term master plan and implemented that in 12 years, 28 years ahead of schedule. It's the second largest economic impact. It's 1 square mile. It's the second largest economic impact in Colorado. The first is the airport. It has a larger economic impact than the entire ski industry. This Chancellor Ellerman recently showed, you look at the growth just in the last 5 years. I came here 7 years ago. If you look just at the last 5 years, it's phenomenal. You wonder why you can't get out of the parking lot at 5 o'clock. This is why, because there are now 25,000 people total. Remember when the Army had it, it was 4,000, and those roads and everything were built for 4,000, and now there are 25,000 people that come to work here every day. It's projected to go to 50,000. And the 2 hospitals, with Children's Hospital and University of Colorado Hospital, really moved up in the rankings year over year now as far as excellence in pediatric care as well as in adult care. A lot of game-changing research that goes on here, everything from personalized medicine to bioengineering. You may work on some of these projects, and the advancements there could potentially bend the curve of medicine. So it's not just a grant that you're working on, or it's not just a project. It could be something that could affect you and I someday. A lot of firsts here. The first liver transplant in the world. The vaccine for shingles called Shingrix is on the market today. We generate a royalty on every single Shingrix vaccine that's developed today. I went to the pharmacy the other day to get my Shingrix vaccine, and they said, well, there's a waiting list. And so I said, okay, put me on the waiting list. Where am I at? 184th. And so thinking, okay, we generate royalties off everyone. That's a good thing, but I'm not going to get my Shingrix vaccine for the next 6 months, which that was invented on this campus. So let's look at where healthcare is headed. And it's kind of interesting if you look at the big buckets of healthcare in the past, from the 1870s of germ theory and those first public health initiatives like clean water, to penicillin and other things that were developed in the 1920s, to the 70s where they came up with randomized clinical trials. I remember my father had hernia surgery in 1972, I think it was, and he was in the hospital for 5 days. Today, that's an outpatient surgery. You look at the advances of medicine. Where are we at today? What they call big data. So they know an awful lot about me and they know an awful lot about you, but how do we relate to each other? And the amount of massive data that's being collected these days is pretty incredible. But the trick is going to be turning data into knowledge and translating that to patient care. And that's where we see the next generation of where healthcare is going to go. A lot of technologies are developed. My team, my career, I've commercialized almost 2,000 technologies, but yet healthcare costs continue to go up. If you look at a pediatric ICU today, a lot of technologies, but are those technologies interoperable? Are they connected care? Are they back? So that's what a pediatric ICU looks like today. This is what it should look like tomorrow. But in fact, that is an ICU in St. Louis, Missouri today. And it's a central command center, much like you would see a pilot flying a plane, but the command center is in the tower. This is the command center, and so you can manage multiple ICUs by the use of technologies that's integrated. So the first thing we did is we started CU Innovations about 3 years ago. How many have heard of CU Innovations? Most of you. So CU Innovations is really looking at harnessing not only can you get a patent, which is inventing, but can you do clinical validation and can you establish partnerships that can bring industry onto this campus? To be honest, several years ago, if you ask industry, how easy is it to work with the University of Colorado? They would say, not very. And we need to change that and develop that. And CU Innovations is one of those ways that we are looking at doing that. Clinical validation means with the advent of this little thing I have in my pocket here and all the other technologies that are being used, what we're seeing is companies from different industries now, other than healthcare, coming in and wondering, how do I utilize maybe a software system in healthcare? Well, they can show me some really cool apps, and it's like, yeah, that's really cool. Does it reduce healthcare costs? Will a physician use it? Will a patient be able to use it? And they're like, I don't know, but that's a really cool application, isn't it? And so we have a living lab at UC Health Hospital to where we can do clinical validation and show very quickly whether that works or not. And we're trying to develop a new IRB process that would be more of an EIRB to develop those things, because we may want to give you an iPad and try it for 3 weeks and see what the results are. If you wait for the IRB process, we'll be 5 versions behind by the time the next iPad comes out to try and develop that. So we're going to have to speed up those kinds of processes. Look at some of the companies that we've developed today. We've had now almost 200 companies in the last 12 months come to visit us. If you told me that I was going to be working with Google 10 years ago, I'd be like, what are you talking about? Today we're working on a collaboration with Google to use a device in the home. What is that? Not Siri, but yeah, Alexa. And so could you utilize this kind of technology that 10 years ago, probably 80% of these names on the companies wouldn't be there. So the entrance of non-healthcare companies into the healthcare, like Google, is really looking at an interesting way of where medicine's going to go in the future. A little bit about the Fitzsimmons Innovation Community, which is the biotech park on the north side. Most of you probably don't spend any time on the north side of Montview. Montview is the road that runs down through the middle of it. Maybe you go to lunch, but most of it. And so what the Army did when they closed the campus is half of it they provided to the university to build a medical center. The north half they provided to a new entity called the Fitzsimmons Innovation Community, or sometimes known as the FRA, Fitzsimmons Redevelopment Authority, to look at building a very unique biotechnology park that was created in 1998 by the city of Aurora and the University of Colorado to really build out the commercial side of it on a single campus. Today we have over 70 companies that are on the north side of the campus and continuing to grow and develop there. So not only can we do great research, hopefully then we can commercialize that and bring those to patients, and all you have to do is walk across the street. So Bioscience One was the first building that was built. That's where actually one of my offices is, and that's where a lot of companies now start. And so it could be two people that started in their garage and now they need one bench, or they may need an office, or they may just need an address for an SBIR grant. That's where you would start. What we're finding now with that many companies, they're starting to grow, and now they're starting to need more space. So we built Bioscience 2, and that was in collaboration with the university, to where you could put university programs in there that also would attract industry. So for example, on the first floor of Bioscience 2 is the bioengineering program, which creates an environment for bioengineering students to take classes in the first floor and walk up to the third floor as an internship in one of the companies. With that comes transportation and other infrastructure build-outs. And so we now have 2 light rail stops, which is really important. The #1 reason why companies are moving here from California is because of workforce talent. It's really hard to compete like that in California. That generation, they don't want to drive their car. They want to take a light rail, or they want to use public transportation, or they want to ride their bike. And so we have to build those types of things in the future, and we're continuing to do so. So this is a pictorial of what the campus would look like at full build out. And so if you look at where most of that right now is an old golf course, and you look at what that could look like in the future. We are currently working on a hotel, which also would be restaurants. I don't know how many of you have gone to the Cedar Creek pub for lunch. I've been there 94 times because there's no place for a business lunch on campus other than there. So building a boutique hotel, what we're calling the Innovation Hotel. They'll break ground this fall. We're going to add 800 more apartments because it's a live, work, play model, and developing those. And can we create some excitement? So, today at 5 o'clock, you might as well turn the lights off because people are gone. How do you get people to actually stay before you get on the light rail station and create that kind of vibrant ecosystem that we're working on? We also, 2 schools will open this fall. A pre-K through 6th grade, both science, of course, you would think, both science oriented. So pre-K through 6 is a private school, and then 6 through 12 is with the Aurora Public Schools as a technology school that they collaborated with DSST, Denver School of Science and Technology, who will actually run that school. So very excited to see the schools coming into place as well. Next, if you walked behind Bioscience One, you'll see this building that's now up. That's Bioscience 3. And that's really for growth companies now. They started out in Bioscience One. They started out with 2 people. Now they have 22 people. Where are they going to go? They need now, they had half a lab. Now they need a full floor of a lab. And so Bioscience 3, which will open in November of this year. So we're seeing the activity of that grow. A little bit about me. I came from the Mayo Clinic. So I was at Mayo for 22 years. I was the chair of Mayo Clinic Ventures. Again, all about commercialization of technologies, as well as collaborations that I developed with IBM, J&J, the country of Ireland, which was kind of an interesting collaboration when you're collaborating with an entire country. But a lot of the things that we did at Mayo, we see the real potential of developing that here. So lastly, somebody asked me a couple of years ago, I think it was my wife actually, said, like, what do you do? And I don't know if I ever had a really good answer, but I came across this in Science magazine in 2014 that says, if discovery is to come of the aid of our great global challenges in climate change, poverty, and disease, we have no choice but to become much better at linking discovery, innovation, and entrepreneurship. That's really what my job is on a daily basis, to make this one campus. If we can create the environment of a single campus, there's nothing like this in the rest of the world. So with that, I'd say let's join the evolution of innovation. Thank you. Right on time. Thank you.
You didn't have any new pictures of the Research 3 that's going up?
Not yet.
No?
Not yet. No.
That's where we're moving.
Yes, I know. Have you seen pictures of it? And it's absolutely a beautiful building.
Yeah. Well, thank you very much. I appreciate that. This one?
Thank you very much. So if you drive on Monty, you see all the construction going on today. Right on Monty. That's a part of that additional parking grant. Okay. And then they'll go right in the front. Right on Monty. Oh, okay.
I'm sorry, it looks like we have a question. The question is if we have plans for Montview and parking, et cetera.
So can everyone hear me?
People are on Zoom, so
Okay.
that's why.
So the
Wait, turn it on.
I'll just, so the first thing we need to do, the problem with Montview is that there's no easy way to go north and south. You have to go on Montview to get to Peoria or to Fitzsimmons Parkway. So the first thing we're doing is we're building 2 north-south roads. So where the apartments are, that's a road called Ursula. And that will be open in September all the way to Fitzsimmons Parkway. And then the next one over to the west is Scranton, which leads you to the light rail station. The north half of that will be open as well in September. So the first thing we need to do is look at the traffic studies. Once you can get north-south connections, how much will that relieve traffic off of Montview? Eventually, Montview will have to change, and we'll have to develop Montview. And we may have to do part of that in front of the hotel. If you've ever walked across there, you either want to look both ways really carefully or run like heck, because the traffic is really bad across there. And so we may have to develop that section once the hotel goes up.
Yeah.
Other questions? Happy to.
Okay, nothing on chat? No? Okay. All right, thank you very much. The next person that we have up is Peggy Roddy. I apologize on the agenda that we had her coworker originally going to present. And Peggy, I'll leave it up to you on what you want to put up. We have all your documents here.
Are they all there?
CHO work order, budget template, how to pay.
Where's the, I don't see the work order. Is this the, no, that's how to pay.
I saw Natalie do them all. Well, let's go ahead and sign the template.
Looks like we're missing the work order.
Okay, then maybe down here somewhere. Okay.
That's the budget.
Natalie, she's not finding the work order here. I know that we were looking at.
It's a PDF.
So it's not this one?
No, that's
No.
just, nope.
Looking at the things that you have on here, but it's
Try
not.
looking at the internet. I think that might be. I too. Oh, okay. Let me see. Let me find it. Ay. Oh, stop. Okay, why didn't it do that? That's Naomi's.
Can we get to it from the link in there?
In here?
It's, no, on the last one. The first one. The SharePoint, can we get to that or no?
No, doesn't look like it. Let's see.
Control. Oh, I bet that's not gonna work.
Okay.
Can you upload it from my email?
Well, I gotta try to get to that email. There we go.
Everybody can see my email. Identity. This guy right here, right?
That's the monster.
Is that the one you were having trouble downloading?
I know, maybe we can just share it like that. I'm gonna share it like this.
That's fine.
Okay.
So I can click on these others here?
Yeah. Okay, would
start
you
it
like
off?
to wear the
Nope,
mobile one?
I'll just stand here.
Okay, all right. I think we've figured this out. So this is Peggy Roddy discussing the new changes to work orders on the MSA. I'm sorry, this is the Peggy Roddy. She's going to be discussing with us the changes on the MSA CHCO process.
There we go. This one. All right. So what do you do if you have a research project on campus and you're going to use some people or services at Children's?
Want to start there?
Sure.
You want to
Okay.
do the work order?
Well, eventually, yes.
Okay.
We'll go through this real quick here. All right, so let's tell you a little bit about a work order. I think it was about 1.5 years ago, maybe 2 years ago, they decided to replace the subawards that we would issue through grants and contracts to Children's and use the work order process. Mr. Van Erden, that was just here, he helped extensively with the legal side of this. Has been blessed by both Children's and the university, and we have started using this process and it works rather well. The mechanism, this is the mechanism to get funds to Children's. for any services that they are going to provide for any of our research projects.
For some reason it is not sharing. Probably helps to hit
Picture.
share. There we go.
All right, so there's a lot more steps to these, but we had very limited time today. So I'm just going to give you the overall basics. So when you are ready to issue a work order, we call it a work order packet that we send over to Children's for their review. We have a work order form and a work order budget. And what we have changed is the work order form. This went from kind of simple to a little bit more. And the reason why we changed it was to benefit Children's and let them have more information than what we were providing. One of the biggest changes is the PI signature is not required any longer on the work order form, but we do suggest that you get PI approval of the budget for Children's, and they say, yes, we're going to do the work at Children's. What we do in PEDS is we request that the PI send us an email confirming that they are okay with it, and we save that, and then we move on. So once you have the work order packet ready to go, and I'll show you the pieces to that, you send it to Research Agreements at Children's Colorado. They will review everything that we have sent, and then they will send that also for signature on their side and return a signed work order back to you. So jump around just a little bit. This is, since we don't issue a sub anymore to Children's, we don't have a PO. We don't establish a PO in the system. So we will pay the invoices from Children's on the work order form. You're going to provide an email address, and they will email you the invoice on a monthly basis. Usually comes around the 12th to the 15th of the month after Children's has closed their business. I would suggest that you review the invoice just like you would for an external sub. If you have a research coordinator that's assisting with the project over at Children's, I would send the invoice to them and say, does all the things on here look correct? You know, sometimes the blood draw gets put on the wrong G0 is what they call it at Children's, which would charge our account, and we just need to make sure that we are paying for what we are actually doing. So to actually pay the invoice, you process a payment voucher in Marketplace. As I said, no SPO is created. We want to use account code 535102, which is medical services. And then on the, I think it's the general page, and I have a specific description here on how to pay this. We put a comment in the financial reports field, and I'll show you what an external to PEDS would input in that field. The reason why we ask you to use the account code and that field is for reporting purposes. So we can go out and run a report on those fields and see what was actually paid to Children's specifically for a work order. And here is where you're going to find the new forms. This first one is a SharePoint that is housed at Children's. Even though you are a UCD employee, you can get in. You do have access. It does require your login and password. And this link goes straight to the page where you can find the forms. We are in process right now of updating the PEDS webpage on the UCD server, so that will be available soon. If you can't get into either one of those, the Children's site, or we don't have it on there yet, on the PEDS site, you can email me, or I'm going to volunteer Laura also. Either one of us can help you, and if you have any questions about how the process is, either one of us can answer the question for you. So let's look at, where's the actual form?
Which one do you want to go to?
The actual work order.
Is it working? Okay.
Thank you. All right, so this is the new and improved work order form. A lot of the changes were requested from Children's to assist with them in finding and locating what project they have. Sometimes they just have the COMERB number and the PI name, but they don't have the title of the project or who the sponsor is. So we provide more information. And if you look, this is very similar to a subcontract. Has basically the same information. So on your initial issue for the work order, you would click here, new work order, and then complete all of the fields that you have the information for. And this is the first page. The reason why we ask if you know if you're going to have a new speed type each year, Children's also sets up a separate G0 on their side. If we have one speed type and we know we're going to get a new speed type the next year, they like to terminate the G0 and establish a new G0 just like we do. Helps them on their side, and it helps us also keep track of what's going on. This is a very important field, the invoice contact email. So if you are the administrator that will be processing the invoices for payment, make sure you have your email address in there. Because post-award accounting at Children's will email you directly the invoice. The second page is all legal verbiage. Don't mess with it. And then this section here, this was pretty much a bone of contention and was of much discussion between the attorneys. We also had a section for the PI, which they agreed we could remove with the PI approval through email. The department fiscal manager in PEDS, that would be the grant specialist that is submitting the work order. If your DFA or someone else wants to be that person, that's fine, but it does need to be actually signed in ink, scanned, and then sent over. Children's won't accept it if it's not signed. Once Children's reviews, they will also sign here, and they will return the work order to whoever sent them the work order in the first place. Let's look at the budget. This was also changed with the last revision. This portion up here is mandatory by our attorneys. Please don't delete it. In PEDS, what we've done here is insert the information here so we know what's going on, and it also gives Children's a little bit of idea of where to start looking. These are the only sections that are allowed on the budget that Children's will populate for us, or if we've already had conversations with them, is already populated. So the personnel would be the research coordinator at Children's. That is a Children's employee. Greenfire is their stipends. We can use Greenfire, but you can't just have Greenfire on the budget. It has to have Greenfire and something else. It's too expensive just to do Greenfire. We've also allowed local transportation, and that is usually Uber or taxi rides where the patient is reimbursed right there on the spot. The lab section could be blood draws, urine sample, you name it, whatever is required for that visit. Procedures, this could be an MRI, it could be a CAT scan, of course, whatever it is that is required for the project. If you have pharmacy costs, if they're actually issuing a drug to the patient, you will have pharmacy costs. And this is new, inpatient room charges. Children's has started actually charging for inpatient overnight. Be aware that if you are going to have these charges, they are very expensive. So make sure that you talk with your PI and make sure that you really do have to have an overnight stay. This last section is for IT services, and it's mainly for informatics. Sarah DeKine's area, they do statistical information. They are housed at Children's, and they are all Children's employees. Before you populate this area, or if your PI is thinking that they need this assistance, you do need to contact, I think it has the email address here, Research Informatics, and Sarah DeKine will get back with your PI and discuss what needs to happen, who's going to do it, how much it's going to cost. She'll give you the rundown on that. These are, again, these are the only items that we can give to Children's. Everything else, supplies, travel for the PI, is on the university budget. So you have to think two different ways. So the last thing I wanted to show you was how to pay the invoice. So we created this not only for ourselves, but for anyone else that says, hey, I have to pay an invoice, how do I do it? And this is a step-by-step. You actually go into Marketplace, create the payment voucher, create or change the location so the check actually goes to the grants management at Children's. And down here, this was where I was talking about the code. So you do want to use the correct account code that we talked about. And on the summary tab, down towards the bottom, there's the product description section. This is what we input into the PEDS. People input into that section so we know what's going on. But if you're non-PEDS, just put MSA, which is Master Service Agreement, CHCO, and School of Medicine. That way we know it's outside of PEDS. And then we also have screenshots on how to do that. So in a nutshell, that's it. Any questions? I know you're dying to issue a work order.
I was looking for this yesterday on the hospital website, and
They're there at that link. I had the same issue yesterday. Anybody else?
Any questions on chat?
Great.
Thank you.
You bet.
Great news.
Let you do it.
Thank you, everybody. I know we're keeping you just a few minutes after, but the last things that I wanted to bring up is that we had a handout about the survey that we had recently. If you have any questions, comments, or anything you would like to add to that, we would be more than interested to hear what you have to say. We have a current steering committee opening. So we have extended that date. I believe it was the 15th originally. So we're going to go ahead and extend it. To what date are we going to extend it? Probably till tomorrow. Okay. Well, there you go. If you can respond to that solicitation, I think we just need basically a paragraph about why you would like to be a part of our steering committee and what you have to offer. And we will be discussing those and making some decisions here shortly. And then we're also going to have a RAIN social in May. We don't have any specific dates or activities determined yet, but we would like to put that tentatively in your calendar. Should be a good time. Anybody have any questions or anything else we want to discuss real quickly? No? Okay, well, thank you very much for coming, and we'll see you in a couple months.